Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about the measures taken to prevent patient fall. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the topic. Patient fall is defined as an event which results in a patient coming to rest inadvertently on the ground or floor or other lower level, resulting in injury. Preventing falls requires a multidisciplinary approach to create a safe patient environment, including a fall prevention program and education for nurses. Let's discuss about the measures one by one. Use a fall risk assessment tool to check if the patient is at high risk for fall. Here are the few examples of fall risk assessment scales: Moore's fall scale, the Henrich 2 fall risk model, downtown fall risk index. If the patient is at high risk for fall, do reassessment frequently. A fall risk band can also be placed on patient's hand according to hospital policies. Next is maintain bed at appropriate height. Bed's height is appropriate when the patient's knees are at 90 degrees and the feet touches the floor. This height supports the patient's mobility to exit a bed safely. If we raise the bed for doing any nursing care or procedure, then bring the bed back to the normal position after finishing the procedure. Next is nurse call bell. Call bell should be very close to the patient as shown in the picture and instruct the patient to use call bell if there is any need for the patient. Next is bed pad or floor pad alarms. If the patient is at high risk for fall, bed pads or floor pad alarms can be used. The foot pad alarms work by triggering an alarm every time the user steps out of bed and onto the mat. The bed pad works by triggering an alarm when the user gets out of the bed. This alarm gives an alert to the nurse whenever the patient is moving out of the bed. Next is place the frequently used item nearby the patient. For example, spectacles, water, books, etc. Side rails should be put up beside the bed always as long as the patient stays on the bed. Next is always lock the wheels of the bed or the bed brake. This will prevent the movement of the bed. Next is placement of foot table or cardiac table. The cardiac table is always placed on the non-exit side of the bed, as shown in this picture. Ensure patient's room has adequate lighting all the time. Keep the patient's room's night light illuminated all the time. Place assistive devices like crutches, walkers, etc. near the patient bedside always for an easy access and mobility. Next is ensure the floor is not wet and slippery. Place anti-slip strips on floor where the patient exits the bed. Educate the patient regarding fall prevention. For example, when patient is admitted, educate the patient and the relatives about the use of call bell and use of side rails like raising and lowering the side rails, etc. Next is elimination needs. If in use, place the bedside commode next to bed on the exit side of the patient. Whenever visiting the patient, address the elimination needs of the patient. If patient needs to go to the washroom, provide adequate support. Next comes frequent visit and monitoring. During frequent visits, nurse monitors the safety measures like the position of the side rails, the call bells, the bed breaks, and also monitors patient's condition, and if patient is taking any medications, watch for the side effects. Next is seat belts are used while transporting the patients. When patient is transferred for any procedure or in-house transfer, either by stretcher or wheelchair, make sure there is seat belts and it should be fixed tightly to prevent patients fall. Next comes use of restraints. Restraints are used to prevent patient fall, but physical and chemical restraints can actually increase the risk of falls and contribute to other negative outcomes such as bruises, musculoskeletal injuries, skin tears, physical deconditioning, pressure ulcers, anger, depression, and anxiety. So far, we have discussed measures taken to prevent patients fall. Additionally, when patient is at high risk for fall, highlighting the patient by using fall risk stickers on the door or at the bed end can give an alert to other healthcare workers that the patient is at high risk for fall. Here you go with the measures to prevent patients fall. If you find this video useful, please like it and please subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.